Congratulations on your purchase of your Dermostamp system. How to perform a Dermostamp treatment. Before we begin, let's sterilize the machine and the handpiece. Preparing the client. Make sure you clean the client's skin before applying the numbing cream. A gentle exfoliation allows for better penetration of numbing cream, so we suggest after cleansing a quick and light once-over with a diamond or water microdermabrasion system. Gently massage the cream into the skin. After 15 minutes, apply another thin layer of numbing cream. At this time, you might choose to occlude the skin with cling wrap to enhance the numbing cream. While we wait for the numbing cream to kick in, let's prepare your work area. Unfold and lay out your dressing pack. Then fill the tray with chlorhexidine and saline. Remove the Dermostamp needle and screw the needle into the machine, making sure you keep the needle sterile. Ready the hyaluronic acid. Here we are using a Cithyl solution. Open your sterile gloves and have them ready to apply soon. Once your client's skin is numb, remove the cream. Put on your sterilized gloves. Sterilize the client's skin with chlorhexidine. You may need to pat their skin dry. Take off the Cithyl solution lid and fill the reservoir on the Dermostamp handle with the Cithyl solution. Then apply the Cithyl solution to the client's skin. Now we can begin to treat. What settings to choose? To get comfortable with this new system, we suggest you start with a setting of 100. This means that there are 100 perforations per second. The difference with using the Dermostamp compared to a Dermaroller is the feature whereby you can change the needle length at will. On the handle, dial anti-clockwise to take the needle length back to 0. Every one full turn clockwise increases the length by 0.5 millimeters. So let's start on 100 perforations per second with a needle length of 0.5 millimeters. How we treat. To get the best treatment, coat the skin with a hyaluronic acid serum to create a slip. We treat by circling the tip. Creating tiny circles about the size of a 5-cent piece allows for an even treatment. A delayed reaction often occurs. Therefore, treat for a few seconds, then move away from the area, as it may take a little while for the blood to rise to the surface. There are 6 needles on every Dermostamp tip, so 6 needles multiplied by 100 perforations per second means that we are delivering a total of 600 perforations every second. Therefore, a setting of 150 perforations per second means 900 perforations are obtained every second. This is approximately double the amount of perforations obtained through the use of a manual Dermaroller. Therefore, a Dermostamp treatment is considered more intense. Once this blood petechiae is achieved, then you can move on to another area. Every so often you will need to stop the treatment to refill the reservoir with the hyaluronic acid solution. By using the foot pedal to stop the machine, you help keep the treatment sterile. A few tips. Treating around the eyes is great with the Dermostamp. Crow's feet can be treated here too. You can be nice and close. We suggest you use a setting of 0.25 millimeters. Even at 0.5 millimeters, the treatment can be too aggressive. Again, treating the upper lip is great with the Dermostamp. We suggest you start with a setting of 0.25 millimeters here as well, because even at 0.5 millimeters, the treatment can be too aggressive. Hold the skin tight and treat, helping the treatment glide better. If you find there is tugging at the skin, you could increase the settings from between 100 to 150. Most treat at a setting of 140 perforations. Constantly ensure the skin stays slippery. During the whole treatment, make sure the skin is always pulled tight. How to sell the treatment. This treatment is quite easy to promote. Using the words needling or needles can often scare off a client. When doctors promote Botox or dermal fillers, they don't explain about the carrier of the ingredients. They don't say, I'm going to use a needle to inject the Botox. They simply talk about the benefits. It's the same here too. Dermostamp is also called collagen induction and scar reduction therapy. It's a system of stimulating the skin's collagen without heat. It's not wrong to mention the needles, but it's not the main focus. If needles are mentioned, say we use fine needles, like acupuncture. The Dermostamp also helps to break apart old scar tissue. The Dermostamp technology is ideal for supersensitive skin and those with a fragile skin. As it's purely a constructive device, not an ablative device, then it just builds the skin rather than burning it down to rebuild. It's the perfect treatment for anyone with sensitive skin. Remember to promote this treatment as an epidermal hyaluronic infusion. Dermostamp is also called collagen induction and scar reduction therapy. It will take 24 to 48 hours before the redness of the skin will dissipate. The petechiae blood spots can stay on the skin for 3 to 5 days after treatment. Once finished, clean the skin with your saline solution and apply your finishing serums. We recommend a hyaluronic acid serum, followed by a plant stem cell serum, a soothing serum, and finishing with a chemical-free sunblock.